when you are doing ophthalmic practice, sometimes you may have to face legal problems. As Dr. Lahane said, when the satisfaction of the patient is not there, the another end is the legal proceedings against the doctor. So, medico-legal comes in ophthalmology when a legal opinion of the ophthalmologist is required as a treating ophthalmologist or expert, or a legal proceedings is against the ophthalmologist. The last is worse for the ophthalmologist. The legal emergencies are legal notice. Generally the person is busy in his practice and the thing comes, bringing something to the knowledge by advocate or court. Do not refuse to take it, as your refusal will prove that you were made aware of it. Notice must be replied through a legal practitioner. Non-replying amounts to admission. Deny each allegation separately. Doctor should use technical knowledge in replying the notice. Summons are issued by the court to make the person present in the court on given date and time, personally or through advocate. Served by post or through bailiff of court. Refusal should not be done. If refused, court can issue warrants. Many times in busy practice, summons are overlooked, which should not be done. If it is done, then the warrant served through the police, then the court can issue the warrant. Maybe bailable warrant, one has to arrange bail, police can give the bail. If bail is not arranged, police will arrest and will keep him in lockup till bail is given or he is presented in court. Non-bailable warrant, police will arrest and keep in lockup till presented in court. This warrant is issued in non-bailable offences and when court orders. Here is a difference between a bailable and non-bailable. In bailable, police can give even the police can give the bail, but in non-bailable, police cannot give the bail. Police statement. Police can come to hospital and do inquire or can take statement, but it should not be signed. Many times they ask to sign, but one can refuse that I will not sign because it doesn't come in the law. Police can call anybody to police station. Woman after not 6 p.m. No woman can be called to the police station after 6 p.m. for inquiry or for taking statement. Police can ask the documents for inspection. Doctor should cooperate. Documents can be seized by police if offence is registered. When to inform the police is the always question whether how you inform or not to inform. Whenever there is a history of criminal assault of grievous nature and you have taken down the history of criminal assault in your record. If death of the patient occurs within 24 hours from the admission in the hospital, where cause of death cannot be certified, during surgical or interventional procedure, death occurs. That many times one meets the table death and the surgeon is then confused. To make doctors safe, so before doing a surgery, see before operation, take physical fitness from a MD physician. Always have a qualified standby anesthetist. OT should have oxygen cylinder. Evidence is receipt of recently filling of the cylinder because court wants the evidence. Court doesn't see what is there in the OT. Suction machine, emergency drugs as per standard list. Written informed consent, patient's language. This is more important, patient's language. Table death. In solo practice, stop the surgery and try to resuscitate with the help of the anesthetist. Call physician or shift to the ICU if possible. Inform police, insist on postmortem, inform relations and try to take them in confidence and do counseling. If possible, do not insist on bill payments. In corporate, trust or government hospital, apart from above this, inform hospital administrator, unit of in charge and superintendent of the hospital. Then the IPC 45 of 1860, section 304A. Causing death by doing any rash or negligent act. The table death is generally inquired under this 304A. FIR is registered. Any death happens in the hospital, generally the table deaths are during the intervention. The death is inquired under the 304A. But doctor is not arrested, though it is a cognizable offence. It is a bailable offense. As Supreme Court has given the guidelines that doctors should not be arrested under Section 304A unless opinion is taken from expert doctor or committee of doctors expert in that field. This is a recent amendment made by the Supreme Court. Previously, police used to arrest at least on the paper whenever there used to be a death in the hospital. CPA, that is Consumer Protection Act. Negligence of the doctor is defined as a breach of responsibility or a duty owed to his patient and which results in actual damage to his patient. Negligence is breach of duty arising due to omission or an act or a commission of an act which no prudent or reasonable doctor under similar circumstances would do. This is prudent is a particular word which differs from a specialty, super specialty and other people, because prudentship is different from a specialty and different for a super specialty. It is not a negligence if the nucleus drop occurs and removal is not feasible, so a delay of several days or even week may be done. If patient requires glasses postoperatively, if dislocation of the IOL takes place, if the patient do not follow the instructions of the doctor and as a result benefits of the operations are reduced or modified or given rise to complications. Section 88A, if eye of surgeon performing YAG laser to rectify the vision defect causes RD. If patient gets heart attack while doing even a minor operation, drug reaction occurs and it is detected and managed. So these can happen, but it is not a negligence. They are known complications, and known complications are not the negligence. If not written on paper, the date of next visit and on any day when the patient feels to consult in between. If the prescribes any medicine other than allopathy, it is negligence without any further proof or argument. If the prescribes medicines on the anybody else's letterhead or other than his own or hospital. Case laws. The doctor is negligent if the cataract surgery is done on patients having vision 6, 18 or more. B scan is not done and the RD is found post-operatively. Vision IOP examination of SAC and physical fitness is not done before surgery. The follow-up dates are not given. Thank you very much.